watching the Jennylyn show, and I'm Jennylyn Gleave, your host. And today, I am so excited because I'm in Guangzhou in China. Yes, I was invited by this wonderful hospital and surgeon to come to China and share the story of his many successes with you. And I cannot wait to turn this interview over to him for him to tell us why he has been so successful and has treated over 6,000 patients successfully with his fat grafting techniques. Dr. Lee?
Yes. Good afternoon, Jennylyn.
Thank you for inviting me to Guangzhou.
Yes, you are welcome to Guangzhou. And I prepared a lot for your trip. I prepared my English. You know, I studied English in the University German. Yeah, I can't speak English. And in the last month, I every day take 4 hours to prepare my English. I hope I can let you know what I want to tell you. But it's difficult for me, I think.
It's not difficult. Since I've been here, I feel like I've been hanging out with an Englishman.
Thank you.
I have been treated like a princess, and I feel very privileged that I was given this opportunity to come to China to do this, because this is a very impressive hospital. And as the days continue that I spend here and I share my experiences with you, you will see what makes this hospital and the people who work here so special. Dr. Lee, your focus has been on fat grafting.
Yes.
Some doctors in the United States don't agree that this is the best technique for replenishing loss in the face. Your specialty is face.
Yes.
Can you tell me why you've been so successful with fat grafting?
I met a lot of problem in cosmetic surgeon procedure. Yes. And I use a lot of fillers and implants. But I think the fat is very natural. And I make a very change. I make a lot of change of the technique to promote the result before 10 years. In the last several years, yes, I can get a good result, a long-lasting result, and a predictable result. I think we can get a good result if we have a lot of experience and utilize a good technique. Yes, many plastic surgeons agree this.
Well, since I've been here, I've been privileged to have seen videos of you injecting yourself, videos of you injecting other patients. I walk around your hospital, and there's evidence of your success everywhere. As I continue to spend days here with you at this hospital and your staff, I am hoping by the time I leave, the doctors in the United States where I live may be interested in finding out why you've been so successful with your treatments of people on the face with fat grafting. Can you tell me how many cases you've successfully treated?
I have treated 6,000 cases, more than 6,000 cases, and utilizing the fat grafting. Yes.
Why do you think that some doctors are not getting the success that you're achieving with the technique?
I think many doctors can get a very good result, but I use a very special fat grafting technique. I named the technique FAAS, FAAS technique, and I use a patent fat grafting cannula to arrange my to arrange the fat tissue in the reception site. This is the most important. But the 3 steps of fat grafting procedure is all important. Harvesting the fat, processing, but the most important step is the injection of the fat and how to arrange the fat in the reception tissue.
Great. And so, before I forget, the name of this hospital is FAAS, FAAS, and I will have the doctor tell us what is FAAS.
FAAS is the first 这个单词叫那个字母。FAAS means fat autografting art and surgery. Fat autografting art and surgery. Yes, the procedure of fat grafting is a procedure of surgery. Yes, but we use this procedure to get a change on the face, and the result is something about artistic design. It's something about art. So I use the 4 word FAAS, fat autografting art and surgery.
And I must tell you that I've spent a large percentage of my afternoon sitting down with Dr. Lee and going over photographs of people that he has treated successfully. And clearly, he's an artist, because when he showed me what they looked like before and when I saw what they look like after, I must admit, not only has he successfully treated them, but he's definitely an artist and has really changed some people's faces that were on the wrong side and gave it beautiful definition and artistic appearance. I think you're amazing, Dr. Lee. Say yes.
I hope to be an amazing Dr. Lee. And you are welcome. And you can interview the people who got the fat grafting, and many of them you can meet here. They got fat grafting more than 5-7 years, and you can see the result after a long time. What's the result? And you can ask them what's the feeling of fat grafting. Yes.
I was also privileged to see Dr. Lee injecting himself with fat today. He has a video of a fat grafting technique and how he improved his nose and his chin and his eyes. And I will be sharing that video with you so you can see for yourself how he has done it. And this has been 10 years later?
It's 2009. 8 years, before 8 years, yes, I do fat grafting on my face by myself. I harvest my fat from abdomen through abdomen, through liposuction, and purified it, and to get the isolated fat tissue, and inject the fat in my nose, thin, and tear trough deformity. Yes, before that time, I have a very big eye bag. It looks very Asian. Yes, and before I used the incision operation to take out the fat in the eye bag, but this may be a little mistake. And now I don't use any incisional operation. I only feel the fat in the tear trough, and the eye bag disappears. And I inject fat in my nose and chin, and to enhance the nose and chin and make it looks handsome. Before that time, I look very ugly.
Dr. Lee, I cannot imagine you ever looking ugly, but I'm sure you agree with me the good doctor is a very handsome man, and I'm sure the enhancements is only added to it. Stay tuned and continue to watch this video because you will get a chance to see what he looked like before, and you can see for yourself what he looks like now. How long have you been a plastic surgeon?
I came in the university in 1881.
1881, were you born then?
1980. 1981. 1981.
I am happy it's 19 and not 18.
Yes, I make it happy for your viewer.
I was thinking, boy, you're a damn good plastic surgeon that you reversed your aging this much since 18th
木乃
century.
伊要怎么说呢？
So,
Yeah.
did you start off being a general plastic surgeon or did you always specialize in the face?
Yes, I have been a plastic surgeon. I began to study before the operation in the operation room for more than 30 years. Every day, I performed plastic surgeon operation. In the first 10 years, I am a general plastic surgeon. I make many operations to treat the patient, and I do skin transfer and skin flap and free flap, and to repair to do the reconstruction treatment for the people. In the second 10 years, I focus on the cosmetic surgeon or aesthetic surgeon. I met health people who want to become more beautiful and more younger. But in the last 10 years, I focus on fat grafting, especially the fat grafting in face.
What made you decide just to stop doing plastic surgery, stop using synthetic fillers, and use fat grafting? What made you decide only to provide fat grafting as your cosmetic repair or treatment?
Yes, the people who want to become more beautiful and more younger, they had such a good wishes come to me, but they have had to stand very injury by the procedure, and the incisional operation is painful and it makes scars. And I think many implants and injectable filler in the tissue in the body is not health. And when we use big amount of the filler, the move will not be nature. I think the best material is the fat. It's autologous fat. But it is difficult. Sure, it should be the best one. I tried to implant fat in the face before 10 years. Yes. It's an innovation. It get better. The technique get better. And now I think this technique is very good. I named the technique FAAS, FAAS, fat grafting technique.
And you get the fat from where? Where do you get the fat that you put in the patient's face?
I can get the fat from the body, and where need to improve the shape. Yes, mostly I get the body from inner thigh, yes, and abdomen, yes, from abdomen and from the inner thigh. Yeah, this is I get the fat from, mostly I get fat from this area.
So you have some happy patients. You're getting their bellies flat while you're filling their faces, right? Because if you're taking the fat out of their thighs and their abdomens, if it's someone with a big abdomen, when you remove the fat, it will significantly reduce the abdomen. Am I correct?
Yes, yes.
And how long does the procedure last?
If I want to treat the whole face, I make the whole face fat grafting. It may be take 1 hour 30 minutes. It's very fast. And before, maybe I will take 3 hours for this procedure. But if I only want to feel the fat in one part of the face, such as tear trough, or only change a nose, it only takes 15 minutes to 20 minutes.
Does this include extracting the fat, or does this only include injecting the fat?
Yes.
And does it include preparing the fat after you've drawn it or you've removed it from the abdomen? Do you just remove it directly and inject it, or do you remove it, prepare it, and then inject it?
The 20 minutes for one part means the patient come in the operation room and then go out. Yes, in this time, I do the local anesthesia. Yes. And anesthesia, yes. And then harvest the fat and process the fat and inject fat in the reception site.
What is the recovery period for someone who has been fat grafted in the face? Is there any downtime, and can they walk out of here and go back to work, or do they need to stay at home because they're bruised, or is there any sign that they've had this procedure done?
Bruising is not so often happen, but you will have a period of swelling. I think the swelling will disappear in 3 to 10 days, usually, in 3 to 10 days. But I don't know what the downtime means. Every day after the operation, you can go out shopping and eating and with your friend, talking with your friend every day. And my nurse who got the fat grafting, whole face fat grafting, they come to work next day. But in the 3 to 10 days, the swelling is visible.
Well, I would imagine everyone responds differently to different treatments, and I'm sure some people may require more downtime than others. Some people bruise. I had a cosmetic clinic, and I know some people bruise, some people don't. It's all a personal thing, but that's still amazing that they will only swell for up to 10 days and they can still go out and come to work, right? Versus when you had a facelift. Because when you have a facelift, you have stitches, and you have a lot more bruising and swelling, and people can tell you did something because they can see the stitches and they can see the evidence that something was done. But when you do fat grafting, it's not as obvious.
Yes. The fat grafting gives you a very short recovery time, but the facelifting, after 1 week you can't go out by the incisional facelifting. I do many facelifting in the second 10 years in my career, but now the people don't have to stand so long time, such a long time.
And over the course of the 3 days, I will be going into surgery with Dr. Lee, and you will be able to see him performing an operation where he is going to remove the fat and then inject it into someone's face. So you will understand not only what he's saying, but you will see him doing it. Dr. Lee, you have certain techniques that you use for injecting the fat. You told me you do globules instead of inserting them into the skin in channels. I will also show you some pictures of what he means, but can you tell my viewers what this means, doctor? How do you inject the fat in the skin or into the face?
Yeah, the most different technique of my fast fat injection techniques is I arrange the fat, I inject the fat in the receiving site. I inject in many very small modules. Globules, very globules. Many other surgeons like to arrange the fat in a many channel. Yes.
Can you tell me why it's important to do it with the globules versus arranging it in a channel?
A very small globule have a very big surface, yes. And then he can get more neutral and to enhance the ratio of life. And when I put the fat in this method, the fat is there and cannot move. And I can use this method to create more precise form. And I can, in a very local area, to inject much more amount of the fat in a local area. And that make the result very good.
So over there behind the camera crew, there's a picture on the wall that clearly illustrates what the doctor has just explained. Dr. Lee, I have a feeling that you're going to be coming to the United States one day soon to treat some people and meet some doctors there. That is my hope for you and for the American people who can enjoy fat grafting with more success, and doctors would be more willing to try it. I thank you so much, Dr. Lee.
Thank you very much. You are welcome.
And before we go, what would you like to leave with my viewers that I haven't asked you?
Excuse
If
me?
anything.
Excuse me?
What would you like my viewers to know about your fat grafting that I haven't asked you today?
Yes, I think it's very worth for every people to look more beautiful and more younger. Yes, it will be the very wonderful gift for every life.
And like I always say, for those of my viewers who think plastic surgery is vanity, you take care of your car, you take care of your hair, your nails, and your home. Why is it wrong to take care of your face and your body? So I encourage you to stay tuned, and I will be bringing you more segments over the next 3 days that I'm here in Guangzhou, and I'm hoping that you're not too jealous and that you will learn something from these interviews. Thank you very much, Dr. Lee.
Thank you. You are welcome.